A clinical psychologist is a mental health professional who specializes in the diagnosis, treatment, and prevention of mental illness and behavioral disorders. They use a variety of techniques to assess and treat patients, such as psychotherapy, cognitive behavioral therapy, and other evidence-based interventions. Training of clinical psychologist. Training to become a clinical psychologist involves a rigorous academic and practical program designed to equip individuals with the knowledge, skills, and competencies required to diagnose and treat a range of mental health conditions. Here are the general steps to becoming a clinical psychologist. Obtain a bachelor's degree. The first step to becoming a clinical psychologist is to earn a bachelor's degree in psychology or a related field. This typically takes 4 years and covers topics such as social psychology, cognitive psychology, developmental psychology, and abnormal psychology. Earn a master's degree. Once a bachelor's degree is obtained, many students will pursue a master's degree in psychology or a related field. This may involve coursework in research methods, statistics, and advanced psychology topics, as well as a research project or thesis. Complete a doctoral program. The next step is to enroll in a doctoral program in clinical psychology, which typically takes 4 to 6 years to complete. This involves advanced coursework in areas such as psychopathology, assessment, and psychotherapy, as well as supervised clinical experience. Obtain supervised clinical experience. Clinical psychologists must also complete a certain amount of supervised clinical experience, which is typically obtained through internships or practicums. This involves working with clients under the guidance of a licensed clinical psychologist, gaining hands-on experience in assessment, diagnosis, and treatment. Obtain licensure. In order to practice as a clinical psychologist, individuals must obtain licensure in their state or province. This typically involves passing an exam and fulfilling certain requirements, such as completing a certain amount of supervised clinical hours. Throughout their training, clinical psychologists may also pursue specialized training in areas such as neuropsychology, child psychology, or forensic psychology. This may involve additional coursework, supervised experience, and examinations. In addition to formal training, clinical psychologists must also be committed to ongoing learning and professional development. This may involve attending conferences, participating in continuing education programs, and staying up to